All right. Um, this evening, I want to share my screen just for a few minutes and then I'll stop. This evening, we'll be having a lecture that is going to be given by our one and only Dr. Olufemi MD Ologun. Dr. Ologun is a pioneer graduate of the Bingham University College of Medicine Alumni Association. He was and still is a member of the Alpha graduating set of doctors. He is currently a senior registrar and the chief resident of the Department of Dermatology and Venereology at the Olufemi University Teaching Hospital Complex in Ile-Ife. He's also currently the Vice President one of the Association of Resident Doctors at the Olufemi University Teaching Hospital Complex in Ile-Ife. And he's also currently the Nigerian Medical Association Osun State Chapter Sports Coordinator. Many of us may not know, but he was the pioneer BUMSA president, and he oversaw the affairs of BUMSA, that is our Bingham University Medical Student Association, the years of 2012 and 2013. He's the husband of one female wife and the father of two lovely children. He's a man of many hearts and many experiences and many shades. And it is my pleasure to introduce him to be the pioneer of this lecture series today. So, ladies and gentlemen, help me welcome Dr. Olufemi MD Ologun. Thank you very much. Dr. Ologun, please unmute your mic and say hi to us. I'll stop sharing my screen now.
Okay, good evening, sir. Good evening, our international chairman and the house. I don't know, am I audible enough?
I can hear you, sir.
Yes.
Sure,
okay, thank you very much, sir. Okay, good evening. I'll try to share my slide immediately. Okay, can we see it?
Yes, we can see it, sir. Very clear.
Okay, it's all right. Thank you very much. So, good evening once again. My name is Olufemi Ologun. Thank you very much for the intro and all the plenty things. First, I would like to say this is going to be more like a gist rather than a lecture. Maybe just a discussion, a session of discussion. I would like to appreciate plenty of our colleagues, both those in Nigeria and abroad, for joining. And at some point, I would want us to, I want some of our senior colleagues to also say something so that this lecture doesn't, or let me say this discussion rather, wouldn't be biased towards internal medicine. So at least people from other specialties can also share their experiences with us. Okay, so I'll just be talking briefly on choosing the right specialty. I'll be using this very short outline. It's going to be a very short discussion. Within 20 minutes thereabout, we should be done. So I'll just talk about some few factors, then I'll summarize and then I'll conclude. In doing that, I'll also be sharing some of my personal experiences and that of some of my colleagues who I've met and interacted with over time. Sorry, let me get this way. Okay, so now baseline, having MBBS gives you a foundation to be whatever you want to be, you can be. You can do anything, you can become, you can do any subspecialty in medicine, you can become whatever you choose to be, but you can't become everything. So that you have to make a choice. And now that choice is actually a major decision in life. And it's important that it is taken very early and pursued as well. So I'll just talk about a few factors that would that one should consider in taking such decisions. First, assess, you have to do a personal assessment, assess yourself, know your strengths and weaknesses, your areas of interest. Then also you consider your exposures and experience over time. And then work-life balance. There has to be a balance. You don't all work and no play makes Jack a dull boy, and the mental health of the doctor is actually very important. So there has to be a balance. You don't just get stuck in your work and abandon other parts of life. You consider the market as well, the job opportunities, the cash is very important. The demands of the people that you're going to serve. Now, what are the requirements for the training you want to go through in that specialty? Is also very important. You have an idea of what it is before you delve into it. Then how do you want to impact your community and the patient population at large as well? These are things you also consider. Then family is very important, very, very important. Whether the family you are making or the family you're from, you have to consider them as well in making your decision. And then look at your geographical location, where you are situated in, how will that affect the people around you? And then you have to look at your purpose in life. Now, career and life purpose, they are two different things. Your career should actually help you achieve your purpose in life. Then you should have a plan. So let's look at assessment, personal assessment. You have to know what your passion is. What are you passionate about? Because at some point in training, your strengths would fail you. It can be very rigorous, but when that happens, your passion can still keep you going. So you have to be passionate about it. I remember there's this prof from Jute then, I can't remember her name, is it Prof Okolo? So she used to tell us in pediatrics that there is no way you can do well in pediatrics if you don't like children. So you have to be passionate about children to do well in pediatrics. So your passion can actually help you. You should consider your passion. What are your areas of interest? What are you interested in? What actually fascinates you? There's one of my chiefs when I was in the University of Lawrence Teaching Hospital. He's a nephrologist. He's so interested in nephrology. Whatever it is, you can wake him up at any time that a patient needs an urgent dialysis and be sure that he's ready to leave his house to come and canalize that patient for dialysis. So your area of interest is, in fact, is a major determinant when you're considering which subspecialty or which specialty you want to go into. So it's also something to consider. Now, your skills, what skills do you have? What have you acquired over time during your time of training in school, your exposure? On the latter note, there's one of our classmates then in Bingham who was very skillful in urethral catheterization, although he's far from urology now, I think, but he actually said that was what he likes doing, urethral catheterization. Now, you need to know what your skills are and to shape what you really want to do. Then you should also know your area of strength. Do you like talking? For people that like talking, you want to know more about people's lives, their personal issues. You may consider psychiatry because they do a lot of talking in psychiatry, less examination, plenty of talking and writing. So for people that don't like too much long stories, you may consider surgery. So you should know your area of strength in assessing yourself personally, and that also further helps you to know which specialty you want to go into. Now, exposure and experience. Okay, I just put this picture of, I think this is a picture of my class people. These are our sets in Bingham. So now you would have gained some exposure and experiences over time during your posting in school. If I write from clinicals for some of us, that our first posting in medicine was first clinical posting was actually M1 medicine. So by default, we started having this bias towards medicine, and those in surgery were having bias towards surgery somehow. And somehow it's shaped some of us and our decision. And then your experiences over time, you would have looked, what do you think? You begin to shape, you begin to find yourself, where do you feel at home? Which subspecialty do you think is yours? You might have done some form of volunteer works, which would have helped you gain experience as well over time. And that can also contribute to the skills you would have acquired. And then mentorship. There could be some consultants or some lecturers that you look up to who would have mentored you. You would begin to see yourself like them, like you want to be like this person. You think this is who your mentor is. For me, then I remember in medicine, I used to look up to Dr. Adetunji, the neurologist. I loved the way he puts the symptoms together and arrives at a diagnosis, which really attracted me to internal medicine. But I knew I just wanted to. I like something that challenges the brain. So you just put one or two symptoms and then you arrive at a diagnosis. And for medicine, the moment you get a diagnosis, you have finished 80% of the job. The rest is just 20%. So now balance is very important. There has to be a balance. You can't just focus on work and abandon every other part of life, because the truth is at some point you now retire and then you can no longer do the job for whatever reason. You can't work again. So what happens to your social life? What happens to your other goals? You probably will have other non-medical goals. Some might want to go into farming, some other forms of business. You might need time. So you might have to learn to balance it. And again, it's good for your mental health. You don't just get carried away and so worked up with hospital work. You're there morning, evening, the whole of your life is there. At some point, you realize that you've not even done anything for yourself as an individual. You've only worked for the institution and for your patients, and there is no balance. It can be so bad that even your Christian life can be affected. You can just be stuck in the hospital 24/7. Sundays you're on call. You're just willing to. They know that you're the one they will call when they need somebody to come immediately. So you have to look for a way to find a balance, and in doing that, um, you should think of a subspecialty or a specialty rather. Please forgive me for saying subspecialty. A specialty that would help you find that balance and create time to also have the opportunity to try yourself in other non-medical goals and have a balanced social life as well. Now, again, you may want to consider financial opportunities, job opportunities, income, which is very, very key. You may want to consider some subspecialties that are well paid. For us in Nigeria, it is flat rate across all subspecialties. However, for people who are abroad, they will tell you some are actually more lucrative than the other. So you may consider that. However, for people that may want to go into private practice, of course, how do I put it now? The financial opportunities might not be the same. But kindly know that there is no there's no specialty that you cannot make money. You can make money in everyone, including mental health. Because some people have thought, how does somebody go into private practice mental health? But those guys are making heavy money. You need to discuss with them. Some of them are actually private physicians to some of these top politicians whose children are into all forms of abuse of drugs, and they don't want them to come publicly, so they see them privately at home, and they are heavily paid. So there's money there, there's money everywhere. You just need to understand the business aspect of that subspecialty, and then you explore it properly. You try to acquire additional skills that makes you different from those that are there, and then you come in different, and then you explore it properly. So you think of the job opportunities that are available to you. Currently, in Nigeria, I think there's job opportunity for every doctor at every level. So it's not really much of a problem. Income may vary, but yes, but the opportunities are there for everybody. Now, you need to understand what you're going into. The moment you decide that this subspecialty is what I'm going into, first you need to make your findings. What is the duration of that training? So that you don't just delve into something and then you want to jump out after you've gone in, you'll have wasted some time. Then you need to know the intensity, what expected of you. Some of them can be so rigorous, so rigorous. You get frustrated at some point. You feel like quitting. It happens everywhere. You feel like, what have I gotten myself into at some point? So, but you need to have made up your mind before going into it, and then you decide that yes, I really want to go into this. So these are some of the things you may need to consider: the duration of the training. Some, like for neurosurgery, cardiothoracic surgery, it can take years. In fact, for cardiothoracic surgery, at some point in these countries, some of them used to go to India for some postings. So I think they do. I'm not sure. I think there is the different, there are some facilities that are trying to come up with ways to actually modify that. So, but it can be that long. And if you want to go into it, you have to be sure of what you're going into. So you need to understand the duration of training and the intensity. Now, you don't just decide to go into anything. You want to know how you can impact your population, the patient population, and also the community, because it will be a waste if you just go into a subspecialty for selfish reasons alone. You should also try to be impactful to your immediate environment and even the world at large as well. So you should think of ways to impact the patient population, to satisfy your patients, and also the community at large. Um, Now, the geographical location you find yourself can also shape your decision in what career, what specialty you want to choose. Now, you have to find out what is obtainable there. For people abroad, I'm sure they will tell you it's easier to go in as a GP, and then you probably write some exams to go in. But there could be some bias at times for there might not, there are some subspecialties that might not want to be given to foreigners, and then probably those ones are kept for indigenous people. But that is beginning to change because even people abroad really are not much into medicine. They are into other things that will fetch them more money. Now you have to find out what is needed in that geographical location that you're in for you to know how useful you would be. Now, for somebody that may find himself in a village, let's say somewhere in northern Nigeria, where maternal health is really that bad, they don't have good facilities or even people available, you may consider doing, let me say, family medicine, where you can attend to almost everything. At least you can do the basic and keep the patient stable until they get to a proper place to get specialist care, or even going to O&G and at least help with safe delivery. So you should consider the location and things that will be needed in your geographical location that would help in actually helping you to impact them. Now, family is a major factor to consider in choosing a specialty. You don't just, medicine is by the time you get your MBBS, going into training for a specialty, for a specialist training can be very rigorous. And then for people who intend to get married, it's something you should have discussed with your fiancé or your fiance, and then make them, whether the person is a doctor or not, you both have to sit down and discuss about it and be sure of what you're going into. You don't just jump easy. It can be that bad. It can shake the family. It can even scatter people's families. I've had colleagues here who have had to abandon their training and because I think two of them, their husband had to travel abroad, and the husband told them blatantly, you can continue your posting, but when you are done and you come and meet me there, whatever you see, you take it like that. So both of them, senior registrars, they had to abandon their training and go with their husband. Now, these are things that you should have discussed with your spouse, and then you would have ensured that, okay, this is what I'm going into, this is what it entails. Hopefully within this period of time it should be done. So he or she will be ready for it, and both of you can actually support each other through that time. And again, having children again it can, in fact, it can reset the whole formation that you've created already, because children, they are very wonderful humans. They need time, they need attention. So you need to know how to create time for them. Now, children of doctors, especially when both parents are doctors and they are too busy with their work, they're at a risk of being poorly brought up. And that's the truth, because you might be engrossed with your work and not have time to actually look after these children, to help train them properly and bring them up well. So these are things you may need to consider. If you're quite young and you're sure that, okay, let me say before, maybe no children until after my part one, maybe when I'm less busy, I can now begin to have children, or after the residency entirely, you can begin to have children. Now, these are things you probably may consider before making a career, before choosing a specialty, or you choose a specialty that you might have time that can actually help you create time for your children. it can be that serious. I don't want to be giving examples so that I don't sound biased against some busy specialties. But like I said, just you may have to consider this in making the decision of choosing a specialty. Now, I said earlier that the purpose of life is very important. You have to know what your purpose in life is. You don't just now choosing a career, or your career shouldn't decide what your life's purpose is. It should be the other way around. Your life's purpose is the main thing, and then your career helps you to achieve the purpose for which you were created. So it's for you to have actually prayed and discussed, and you've discovered your purpose in life. Then your career should be shaped towards achieving that purpose. Because the truth is, if you go through life without achieving your purpose, then it's almost as good as a failed life. Now, like I said, the career is a tool to achieving your purpose in life, and a successful career does not necessarily translate to fulfillment in life. I'll just give an example. Recently, I watched a video of Arsene Wenger, that's the former coach of Arsenal, and he was talking about how he sacrificed his life to football. He never had time for family, and he had a lot of regrets. He regretted, he wished he had a proper family. He just had his daughter, and I'm not sure if he ever got married. So he said he wished he had a bigger family, and then he's trying to correct everything. The man is over 70 now, he's in his late 70s. At some point, he was even crying in the video. That means he had a successful career as a football manager, but he's not feeling like he's fulfilled in life. So you need to have discovered what your life's purpose is, and then your career should actually help you to achieve that purpose. So in making a decision for to go into, you have to also consider that your purpose in life may not necessarily be that you just want to be a, let me say, whatever. Let me not stand bad. You just want to be whatever. You have to choose it and be sure that yes, it goes in line with your purpose in life. So you have to plan. In planning, you create a template. You've set goals that okay, these are the things you want to achieve, and you put timelines to these goals. That are so time, this is what I want to do by this year, this is what I want to do. Be sure that 90% of the time, it always doesn't go that way. The timelines will be broken, but be sure that it still helps to keep you in check. The fact that you've set your goals and you have a timeline, at some point, God comes and changes everything. So by the time you pray, it's easy. If you have a timeline, be sure that it's easy for God to change that timeline. And even if he's going to scatter the whole plan and template and this thing, he will be impressed that at least you can even work with templates. So by the time it comes with its own templates, it is easy for you to follow. You can be trusted to follow a template compared to somebody that doesn't just have a goal. They're just there being blown up and down with the breeze of life. I'll just briefly summarize. So I think, again, like I said, you have to assess yourself personally. You consider your exposures and experience. You have to balance work and life, and then consider what's obtainable in the market. Your training requirements, you have to be well familiar with them. And then how do you want to impact your immediate environment? Family is very key. You have to consider that your spouse, your children, and then your location, where you want to be located, then your purpose in life, then your plan as well, and then be sure that it's in line with God's plan for you. So I'd like to conclude by saying that choosing choosing the medical specialty is actually a complex interplay of multiple factors. And when doing this, you should take the decision to help you achieve a career satisfaction and also making meaningful impact in life. Thank you very much. I hope I haven't bored you with these few points of mine. Thank you.
Wow, wow. That was an amazing lecture. Thank you so much, Dr. Ologun. You've done justice to the topic, and even me, I'm blessed. Permit me to use church lingo. Thank you so much, sir. I believe that everyone that has listened has been blessed, has learned something from this lecture. For those of us that are having trouble with network, I assure you the lecture will be made available for you because we are recording the lecture. Okay. Before I take questions, I want to take about 2 or 3 people that will give us, maybe take 2 minutes to give us some of their own experiences and how it helped them to choose the specialty that they are currently in. So I'm going to call randomly about 3 names. And first and foremost, let me acknowledge the presence of Dr. Fonkaza Daniel Didamson. Dr. Fonkaza Didamson is the pioneer CMDA Students President in Bingham University, and he's currently also the Vice President of the North in CMDA Nigeria. You can see he's not a small boy, and he's also a senior registrar in the Department of Neurosurgery at the Ahmadu Bello University Teaching Hospital. Thank you so much, sir, for making our time to be with us here. Sir Didamson, you will acknowledge our greeting, and we're going to give you 3 minutes, sir, to say 1 or 2 things on what made you choose the specialty you have, because I want us to take some life experiences so that people can learn from some of the things that are also going through their mind. And after you make your speech, I will ask Dr. Sheun Akinloa to speak after you for another 3 minutes, and then we'll find the last person before we take a few questions from the audience. Thank you very much. Dr. Fonkaza, you have the floor.
Sir, can you hear me?
Yes, sir, we can hear you very well.
Oh, all right, thank you so much. Thank you for the opportunity. Thank you, Chief Ologun. You did very well, seriously, you did very well. I was just enjoying the whole talk and your slides. I said, God, this guy has a lot of time to, to prepare a wonderful slide.
Thank you, sir.
All those, yeah. All right, so back to the whole issue. Okay, for people like us, you know, right before medical school, one of the things that I was so sure of is that I was going to do surgery. That's because I had experiences. As some of you may know, I did nursing before, and so I worked for some years before the medical school. So even while in the medical school, anytime we are on break, whenever I had the opportunity, I would go back to the hospital I was working before. It's an orthopedic hospital with a lot of surgeries and all that. So I knew I was going to do surgery. And then while in clinicals, I read Gifted Hands. So when I read Gifted Hands, I know the struggles I went through in medical school, and I was just seeing quite a lot of things as if the guy was just talking about the picture of my life. And I felt, this is an area of influence. This is an area that somebody can really do it. So throughout, I believe all my mates, Chibuzo and Co, they knew that this guy was just going to do surgery. There was nothing else. So throughout the posting, and so by the time I finished, I insisted on doing that surgery. But it wasn't without some challenges. I remember when we started writing primaries, wrote primaries, and then all of a sudden I didn't pass, primaries in surgery. So it was becoming something else. At the point I started thinking, my show, I'll really do this surgery. But every time I decide to think of another specialty, I would like, will I be happy doing that specialty tomorrow if I decide to change specialty just because I didn't pass the primary? So, but I persisted, and then by God's grace, I passed, then started the residency. So once I started the residency, I knew that definitely it's going to be neurosurgery. But at the point, while working in pediatric surgery, I discovered that I seems to like pediatric surgery in a way, because we know, okay, in Bingham, in our school, we didn't have any neurosurgeon that is always there to kind of make an influence and all that. Most of the neurosurgery lectures we had from visiting lecturers that's not really readily available for clinical work. For them. So um, shortly before my part one exams, I was still considering, but neurosurgery was first on the list. I was contemplating if I'm not able to do neurosurgery, then pediatric surgery. But I was posted to pediatric surgery because I've done it before. So shortly before my exams, I stayed there. Then I was enjoying it, but one of the consultants there just did something that just blocked my mind completely to pediatric surgery. So once immediately I passed my part one, because I just went straight to neurosurgery. Even in our discussion group in part one, a lot of people thought I was going to do pediatric surgery because of how I was going with the whole thing. So that was my driving force, and so right now I'm in neurosurgery and I'm happy doing what I'm doing. So I would say that's just my driving force. And one of the things that Dr. Ologun talked about is considering some things, especially when it comes to issues of family. We know, okay, my wife is in 1G. So a lot of people will be saying, right from the time when we were writing primaries, some people will say, you, surgery, your wife, 1G, can't you make that to change and all that? I asked her the simple question, what are you happy doing? What would you love to do? Because it's not just about now, it's about the future. And she insisted she wanted 1G. I said, of course, go ahead. And so that's why both of us, we are both in busy specialties. But we know just within the period of training, by the time all of us become consultants, can decide on our own how things are going to be, of course. And so, but the issue is not about just being busy, but being happy doing what we are doing. So I think that I'll stop here. Thank you very much. Okay, I'm seeing
Thank you
like
so much,
there's a question.
Dr. Okay. For you?
Thank you so
Well,
much.
not yet. Sorry,
Sir.
Dr. Kinloa, before you speak, let me just say thank you to Dr. Didamson for that life example, because I can even draw some parallels from what Dr. Ologun has presented. I mean, the thing that helped you to make your decision were things like your um, exposures, the things you were exposed to, having to work in a hospital, reading gifted hands, and also the fact that you are passionate about doing surgery from the beginning. Those were some of the things that led you to choosing the specialty you chose. And I also want to thank you for not stifling your wife's own original passion also, because I know I've worked with her very closely. I know she's a passionate obstetrician and gynecologist. So thank you very much, sir. I'll give the floor to Dr. Mrs. Akinloa. Please, I think, forgive me, Mrs. Akinloa, I don't know if you are a senior registrar or if you are now a consultant in the Department of Psychiatry. In somewhere in the United Kingdom. Please, you have the floor for the next 3 minutes, ma. Thank you.
Good evening, sirs. Good evening, Mas. Good evening, everyone. I'm very grateful. Thank you, Dr. Logan, Dr. Didamson, Dr. Chibuzo, and everybody. Thank you so much. I really enjoyed what all the speakers have said. I have learned so many things. Yeah, so I currently work as a forensic psychiatrist. I'm still in training. I'm in ST5. It's 6 years by God's grace. So I'm in my fifth year. So the question you asked on Kuchibuzo is that why did we choose our specialty? First, I had a dream, many years ago. that I was singing. And interestingly, at work, I sing. I work in a mental health institution. I love people. I love to, just, hear people, listen to people, and then also to see the underlying traumas, beyond the surface. I remembered before I even traveled out, before when I was in Nigeria, before I even started Bingham University, before university, I had the passion to work in prison or to work with NDLEA, but I didn't know how to go about it. I did not know how to go about it. I just like, the fact that prison criminals, how can we help people, irrespective of their crimes, irrespective of what they've done, irrespective of who they are? And that was the main force. And when I came to the UK, by God's grace, um, I actually went for a lecture. And the man was like, "No, I'm a forensic psychiatrist. I don't need your gift. I don't need your money." I was like, "Okay," because he was teaching us on how to write exams, on how to do something so that we can get trainings. And I offered him something and he said no. And I was wondering that, okay. And God said, yes, that is what I want you to do. And I'm like, forensic. I don't think I like rhymes. So I don't think my heart is strong for it. But, by God's grace, I'm happy doing what I'm doing. I love my job. And like Uncle Femi Ologun rightly spelled out, at some point, not just only for females, even for males, there must be work-life balance. And even though I would say psychiatry gives more work-life balance than other specialties, but the part of psychiatry I'm doing sometimes may not give many kind of a work-life balance because we work with the criminal justice system, we work with the Ministry of Justice, we write court reports when someone commits an offense. We want to know what happened. I remembered, I'm so sorry. I hope this will not trigger some people. When I heard about some Bingham student that, had that used drugs and one stabbed one man and all that, for me, I knew it was more than that. It's not just, him stabbing someone. For me, I just knew this is more of paranoid schizophrenia. And so we need to get to that point where, with the help of God, our work, our life, brings glory to God and we are able to help other people irrespective of the silly things they might have done or they will do. So that's it for me. It's all about passion. It started with just wondering. Thank you, everyone. I'm grateful.
Thank you so much, Dr. Akinlua. I appreciate your succinct examples of what made you choose your subspecialty. Thank you so much for that. I can still see exposure, I can still see interest and passion as key factors that form the foundation of why you chose the specialty you chose. So thank you so much for sharing. Please, if you have a question, kindly drop it in the chat box so that our speaker can begin to handle some of the questions. In the next 2 minutes, let me give my own example. As many of you may know, I'm in the Department of Obstetrics and Gynecology, currently a senior registrar in the Department of Obstetrics and Gynecology at Just University Teaching Hospital. What made me choose O&G? I can almost assure you that I don't know how I got into O&G. I know that from the time I was a little child, there are two things I've always wanted to do with my life. And the two interests I've always had were, number one, I knew I wanted to do ministry. And two, I knew that I wanted to be a doctor. And so my mother used to tell us stories, even now that we're older, that when I was in primary school, I used to write Reverend Doctor on my textbooks, because from a childhood, those things, I think they were very clear to me. And so fast forward, going through medical school, when I was in medical school, I used to tell people that I was not a very serious student. And because when we started having the delays that we were having as pioneer set in Bingham University, I ventured into so many other things, into business, politics, ministry. So at that point, I lost a lot of steam for studying. And so I was just cruising through until I graduated. However, when I graduated, I made a decision that I'm going to be a serious doctor. And so I when I did my house job, I kept an open mind. In fact, when I was graduating from medical school, um, uh, one of my interests was community health. I wanted to do community health because I enjoyed the training and I enjoyed the money that some of our lecturers who were doing community medicine seem to have. However, when I did my house job, I made up my mind to keep an open mind and enjoy all my postings. And that's exactly what I did. I enjoyed all my postings when I was doing my house job. But after that, I sat down and asked myself, out of all these postings you have gone through, which one do you enjoy most? Which one do you think makes sense to you the most? And so when I first wanted to write primaries, I got materials to read for surgery. I wanted to do surgery because if you know me well, you know I don't like talking too much. And I prefer to work with my hands than to talk with my mouth. So talking is not one of my very strong suits, especially one-on-one. And so I made a decision to do surgery. However, when I looked at everything, I asked myself again, and I discovered that O&G, obstetrics and gynecology, came easily to me. I understood it. When I read obstetrics and gynecology, I understand it easier. I understand it better than I would understand surgery or internal medicine or all the other things. And the concepts in O&G were not strange to me. And so I advised myself after much prayer that it would be easier for me to do obstetrics and gynecology because it's what comes to me easily. And I had the privilege of having a sit down with Professor Dankel then. And he asked me, why did I choose O&G? And I just simply told him that it was what came to me easily among all the other specialties I had considered. And he told me something I'll never forget. He told me that, believe it or not, that is a very good answer. Because what comes to you easily may not come to the next person easily. And that statement he made struck me, that what comes to you easily may not be what comes to the next person easily. And so I discovered after that discussion that because O&G came to me more easily, I think that it is better that those are where my strengths are and my skills are. And I followed that until here I am now. And I can assure you I enjoy my work very much. And also, as a surplus, or as a plus rather, O&G has less fatalities or mortalities rather than other subspecialties, in my opinion. So thank you very much for listening. I'll look at the chat box now, and Dr. Ologun, please look at the chat box if there are any questions and begin to do justice to them. Thank you, sir.
Okay. Thank you very much, everybody that has spoken. I really appreciate that. But please permit me to also invite Dr. David Ogenejiwe, essay Independence, to just say something briefly within 2 minutes. I don't know if you can hear me, Dr. Essay. Hello, is it still, am I audible, please?
Yes, sir, we can hear you.
Yes, sir, you are.
Yeah, you're audible, sir. Good evening, sir.
Yes,
Yeah,
sir.
welcome, Dr. Ese. It's good to have you here, sir.
Yeah, it's a pleasure to be here, sir. Thank you very much, sir. Thank you. Okay, let me not waste much of our time. I think I enjoyed your lecture. Sir. They were not points that we're all not familiar with. I think most of us that are married have actually gone through this route. We had sat down with ourselves. We had sat down with God, because that's most important. For anybody who has not done that, please, I would want to say that you sit down with God and know the direction for your life. It's very important, because at the end of the day, you will always remember these very crucial decisions to make. And I think there were times in my life where I had to make those kind of decisions of call, and then God gave me direction. So in making my decision for what I wanted to do, like Dr. Chibuzo said, what came to him so easily. Now, for me, I do not like to cram, and surgery was one area that has to do a lot of cramming. the structure of the arteries, the structure of the organs are like that. You cannot change it. You cannot think it out. It is how it is. And so if that is the principle of surgery, you have to follow it. But for medicine, it's quite different. You would have to think it out, and which is what I love. I love to think out things. I don't just want to cram food. You tell me something, let me explain it, let me do it better, and then find other ways to do it and do it better. So medicine was something that came to me so easily at the point of making a decision. And then I'm somebody that is family centered. Okay, so because I'm family centered, I always want to look at what will benefit my family per time. And medicine for me was one area because the higher you go, the easier it becomes medicine. So you have more time with family because to be very frank with you, at the end of time, your investment in family is what you enjoy or reap more from, not your investment in your work or your career. So for me, I've always been family centered. So I had to look at what to benefit my family in the long run, and internal medicine came very easily. And then, of course, the area I'm also pushing into, which is nephrology, is one thing that has been pressing in my heart for a very, very long time. So it wasn't very difficult for me to make up my mind, even when I was finishing my house job. I already knew internal medicine. From the beginning, I thought it was O&G. But at 400 level, the things I saw and how, let me not just begin to say all those things, but the things I saw discouraged me completely. I told myself I cannot do what that one. It was, I just put X on that one. But during my house job, I was thinking of surgery. But when I realized I would have to do some more cramming, I just pushed that aside. So please, I would want you all to, anybody that has done it from your mind, please sit with God. He will always direct you where you should go. And then when you have that rest of mind about the career, then I think you may be on the right path. But don't forget, family should always come first. At the end of time, when you are 65 years and above, you realize that you enjoy more from all your investment in family than at work. So let me just give an example. There was a house officer of mine from the other religion. She had issues with her marriage. She was almost having issues with her marriage. One day, and I saw her doing the ward round. She was really so down and all that. So when I approached her, I asked her, what's the problem? She was reluctant to speak. But somehow, I had this conviction in my mind that she was dealing with family issues. So I told her, I said, what's the problem? I think you're having issues with your family. That was when she opened up. And I told her, I said, see, you would have to put family first. If at all you want to really enjoy your life and enjoy family, family has to come first. Your husband is not the doctor, which makes it even worse. So he will not understand no matter what you say. So try to make him understand by doing what he can understand. And so you would have to find time for him, and then the process explain to him. And then when it comes to making a decision on where to go to, by the time she was almost done with her job, I think she was the last person. She came to me and asked me where I think she would best function. And I told her, I'm not going to choose for you, but I will tell you, for your husband and yourself, you want happiness and all that, I think you should go for somewhere that will give you much time. And then finally, she went for family medicine. She wrote primary school and she made it. And now she's doing family medicine. So it is, you just should find a way around family so that you would enjoy your life. Family should always come first. I beg you, family should always come first. I don't know how many times I will say it, but I know as you get older, you will understand this statement better. Thank you very much, sir. Thank you, ma'am.
Yeah, thank you very much, Dr. Ese. Sorry, I had to call my brother in internal medicine to say something. Okay, so briefly, let me also quickly just share a little how I found myself in dermatology. Plenty of my classmates can attest that I had always boasted that I could never do dermatology in my life. It has always been internal medicine, and I wanted to be a nephrologist. In fact, I already planned that. The day I finish school, right primaries, go and do nephrology, open one shop and start dialyzing, they counting your money. That was my own template. That was my plan all the while. And yes, I wrote primaries and passed and started, but somehow, in fact, nowadays I've learned in dealing with God, be very careful of what you wish for. Because in my own case, sometimes I believe God just deliberately chooses those things that I keep boasting that I would never do, to push them. That's where I end up. That's what I end up doing. I had started residency first in University of Ilorin Teaching Hospital. And the sole reason why I actually went to Ilorin then was because I wanted to be closer to my mom. I had been far away in far Jos. And then, so shortly after NYC, I got married and I had gone to, but I had to go back to Jos because we're employed. Most of us in first set were employed. So then we're pushing to actually get our release letter to go and start residency as supernumerary residents. But then the whole effort was frustrated, and then eventually we got released. Okay, let me just try to rush that. So I eventually was lucky and I went to Lorraine and started. Everything looked very strange. It was far from what I expected. Shortly after I started, I think about 2 months or so, I got a call from Bingham and then they stopped paying us. So I was just stuck there. I didn't want to go back to Jos. At some point, I considered stopping residency and let me get one MO job and start doing at least because I had to feed my family. My wife was heavily pregnant then. So I was just working without pay, and it was very rigorous. For those that probably have worked at the University of Lorraine Teaching Hospital, internal medicine can be very busy there. Then I didn't even know I was already getting depressed gradually. As God would have it, my mom passed on some few months after I started residency. So the whole of Ilorin felt I had lost interest in that city entirely. In fact, I didn't know it was that bad until I think there was one day we're doing a ward round, and then going from the male ward to the female ward, there was this suicidal thought that just crossed my mind, and I had to just rebook it immediately. I just tiptoed into the residence call room, and I had to sit down, and I was talking to myself like, has it gotten this bad? I was working without pay, and everything was just frustrating. Luckily, before then, I did interview in OAU. Somebody had called me. I applied for internal medicine, but someone had called me that, guy, come and change this into dermatology. It's an easy way to enter. And funny enough, then I was frustrated and I was desperate for a job. So reluctantly, I said, okay, change it to dermatology. I said, let me even start and finish my part one. I can always look for how to change. But by the time I finished my part one, by the time they called me rather from Ilorin that I should come and resume in OAU, I was filled with joy. I couldn't just wait to leave that town. Funny enough, I had left, I wrote my resignation, and then Ilorin now called that I should come back and withdraw my resignation and start working as a full resident. But I had lost interest in that town. I didn't even want to be there anymore. So eventually I left, and I had to live with my family, and we came to Ilorin. Funny enough, when they called me, baseline, I should have been very happy to have gotten appointment to stay in Ilorin and continue and do my nephrology that I always wanted to do. But I realized that I lost my peace. I wasn't at peace with myself. I was very cheerful. I was at peace when you called. But when Lauren now called, I should stay back and continue my life. No, I just couldn't hold it anymore. And that was why I left, and I landed in Ife as a dermatology resident. Because in Ife, dermatology is a separate department from internal medicine. Although we do the same posting, the same exam, but we're a separate department. So you're employed as a dermatology resident. So that's how I landed here. And interestingly, I have very nice consultants. Everything has been very soft. Let me even put that disclaimer. Dr. Sheon Akilo has said psychiatry gives you more time. I tell you that dermatology gives you almost all the time you need. Because when we run clinics, we barely have patients, inpatients. So you have more than enough time. So please, when it comes to time, we are the first. Now, Dr. Samuelson said mortality. We don't have mortality in dermatology. We operate on the largest skin with the smallest mortality.
Now you are biased.
No, I'm telling you my experience. That the lecture has finished. Now we're all
Yes,
discussing.
bias.
Go ahead.
I
Go
agree.
ahead.
So we operate on the largest organ with the smallest mortality. So it's the only problem I've had with dermatology is convincing myself. So I've like everything has actually been very easy and has been working perfectly. I've had 6 consultants and I've been the only senior registrar for 3 years, and all of them are on my neck. This guy, come and write your exam, and I'm just like, you understand? So it's, when I look at it and how did I find myself here? I think that was what God had for me ab initio, and then the way he channeled it, so is the only one that would be able to answer that. So again, I think there are quite a lot of things to consider. But like I said, God can actually reroute your plan. It's good that you have a plan, you have a template, but it's easy for God to even change that template as long as there's a baseline template. Or even if he brings a new one, at least he trusts you to follow a template. So it's good to actually have something. Now, there are some questions that were sent. They are pre-lecture questions. And one of them is on what basis or what yardstick. I think we've answered most of the questions actually. I'll just read them out and then maybe just pick one of the answers that have been said. On what basis or what yardstick should I use from my experience to choose the right
Sorry, sir.
specialty?
Sorry, Dr. Ologun, if I may, because
Yes,
of
sir.
time, maybe just look through the pre-lecture questions. Anyone you think that your lecture did not touch on, just answer so that.
Okay, sir.
And you can also look at the chat box. There are a few questions there
Yes.
so that we can round up very soon. Thank you, sir.
Okay, sir. Yeah, thank you very much. Okay, so on what basis and what you say do I choose the right specialty for myself? I think we've discussed that. So if one is interested in women's health and wants to acquire O&G related skills, but eventually wants to go into academia, what pathway would you advise? If you're going to acquire skills in O&G, then I would advise you do residency in O&G. That way you acquire both the stuff and also the surgical skills and all the skills you need. And the moment you become a consultant, you can easily go into the academics if that's what you want to focus on. You can do a master's, also do a PhD, and go along that path. But if you really want the skills, then it's good for you to do residency in O&G. Now, which specialty best suits private practice? Private practice is family medicine. That's my opinion. Family medicine actually, they have an idea of everything. They do postings everywhere. I call them jack of all trades. They do postings everywhere, so they have an idea of almost everything. Now, which specialty is more entrepreneur inclined? You can become an entrepreneur in any subspecialty you want. Again, sorry, you can do private practice in any subspecialty too, but if you want to do everything put together in one, the family medicine will be very good. Now, should geography be considered in choosing subspecialty? Yes, I've discussed that earlier. Is it late to change subspecialty? It is never late. As long as you're alive, you can change. If you're not convinced, if you have something that is pushing you somewhere else, you can change and be sure that. But the problem with changing, especially changing at a late, how do I put it? It increases you have to have a lot of perseverance, and then you take a lot of rubbish and patience, because the truth is, in this medicine, that you finish medical school before someone doesn't mean start residency before that person. And even if you finish residency before, it doesn't mean you become a prof before the person. So sometimes if you don't go on time, the person that probably was your school son in school might be your chief reg. So if whatever you do is better, you discuss with God and discover it on time and start it early enough so that you don't get you don't go and slap your chief one day and you get into trouble. So it's not too late to change. But when you're changing, be sure that if you change late, be sure that there are some consequences to it and be ready to just face it and focus on your goal. Now, managing career and family, I think we've exhausted that. You have to consider family in making your decision. Now, availability and duration and how long and the full accreditation. I think this one you can easily find out. Different subspecialties they have various duration of training. For the accreditation is center-based. Now, time and finance, of course, you can make you can make good money from any subspecialty. You just have to know how to activate the business end of it and acquire some extra skills that will make you different. Now, is it okay to choose a specialty because it appears less demanding than others? Sure, it's okay, because you have to create time. You have to balance it, create time for other things as well, including other businesses. So you don't have to make all your money from the hospital. In fact, the hospital should be your side hustle while you try to also get money from elsewhere. What are the factors to consider when choosing? I think we've talked about that. Which is more rewarding based on finance with less workload? Asking because as a woman, I would like to have time for my family. That is very important, very, very important. In fact, Women usually have some form of delay because of pregnancy, delivery, going into mat leave. So it might delay them a little, so the men can move this faster, easily. And honestly, it's not easy for a woman to actually do residency, especially in Nigeria here. So you may consider some subspecialties or some specialties that may actually give you time for that. I wouldn't want to say, but the truth is dermatology will give you all the time. I tell you that. Now, I think I've answered. Then, how do I know I'm choosing the right path? You have to be convinced. And when you're doing it, sometimes you feel at peace with yourself that this thing you're doing is right. But again, you have to pray about it. Then, what should one take into consideration while trying to choose? I think we've talked about that. Is failing exams several times in that specialty a sign you chose the wrong specialty? No, it is not. In fact, you will get to a point where, how do I put it? I don't want to say you don't feel bad because you fail exams in medicine. There are so many factors to passing an exam in medicine generally, irrespective of the specialty you're going to, so that you failed an exam or you wrote and failed. In fact, it might be the next one that you're going to write that you pass and then you now want to abandon it. So failing an exam is not necessarily a sign that you're in the wrong specialty. You just have to sit down, reassess the whole thing, and then find out what you have to do differently. And again, you have to pray about it and be sure that that's what you want to do. But if you're not sure ab initio, or you're not interested, your passion is not there. In fact, the failure has already even started before you even started it. So it's for you to have assessed it and made the right decision, then you go for it head on. If you can go through medical school, be sure that you can do any specialty at all. Okay, I think that's that. Okay, then the questions from the chat box. They say, what if I can't find a specialty I like? Like I said earlier, medicine, MBBS gives you a very broad foundation. You don't have to go into specialty training. You can even just go straight into academics, do masters, do a PhD, and you do excellently well. Even if you want to be a lecturer, if you want to do it, go to business and abandon the stethoscope. Beautiful. You don't have to focus, or you don't. Everybody shouldn't. Not everybody will go into residency. You understand? Not everybody, but you can always make a difference in whatever you want to do. But that MBBS on its own is actually gives you an added advantage compared to others when you go into the market. Now, is it okay to change specialty because of high cost of training in my chosen specialty? Now that is relative. Again, you should have counted the cost before going into the training, so that you should have found out from people that have gone ahead of you in that specialty and then know what it entails, both the physical challenges, what is expected of you, the financial implication. But the thing with finances is that it keeps changing. The exam 3 years ago when I wrote part one, it's not what it is now. It keeps changing, and then with the economy. So again, it might not be straightforward. Now, do you take course in
Sorry,
dermatology? Yes,
Dr.
we take
Logu.
course. Yes,
Sorry,
sir.
Dr. Logu, can I say something about that?
Okay, please just
Or you
kindly
want,
just
you want to finish first?
Yes, let me just round up.
Okay,
Kindly
just
note
finish.
your.
I finish. Okay.
Yes, sir. Thank you, sir. So, do you take course in dermatology? Yes, we take course. We take course. In fact, I've been on call every day until recently that God blessed me with 2 supernumerary residents. So I've gotten some relief. We take course in dermatology. Now, although abroad, I heard that in the UK, because some of my chiefs who have jackpot, who are now consultants in dermatology, they don't really take calls abroad. They just work till 6 and go home. Whatever emergencies, cutaneous, let me say skin emergencies are not too common, but when they do, they can be very fatal. But however, the medical team on call can keep the patient alive till we arrive the next morning. If I become a specialist in Nigeria and go abroad, if I become a specialist in Nigeria and go abroad, will my certification still be valid? Now a lot of things are being done by both colleges, both the West Africa and the National College. But one thing that I know for sure is that your years of experience count beyond your certification abroad. So I'm sure when we have our lecture series on JAPA, I'm sure they will deal on that very well for us. So I think those are the questions. I don't know if I'm missing anyone out. Thank you very much again. Thank you for your time, and thank you for everything. So Dr. David, you have the floor. Dr. Samuel.
Okay, thank you. Thank you very much. Just quickly, concerning the question about should I change my area of specialty because of high cost of training? I would say no, and that will be on the grounds that you have actually heard from God concerning your area of choice. Now, if you have actually heard from God and you are sure that that is the direction, I can conveniently tell you that God will make provisions for you. And I will just give you a personal experience. When I was trying to make up my mind which college I should go for, either national or West Africa, after much prayers, I was convinced I should go for only West Africa. So at that point, I had so many financial issues. I had my dad's retirement party coming up, and I wanted to do something very big as an appreciation for what he has done for us and my siblings. And that was in millions, you get. So, and then my exam was coming up. Luckily for me, I went visiting my cousin brother who works with the United Nations, and then I was having a chat with the son and putting the son through some academics. So when he came around and we started chatting and talking, he asked me what my plans were, and I wrote out my plans for him. Immediately, he just told me that every of your exams, once he's ready, just let me know. I'll pay for them. I thought it was a joke. He called me. Okay, when the advert came out, I sent the advert to him. West Africa is $425. He just told me, go and get a domiciliary account. I quickly ran to Zenith Bank. I got a domiciliary account. Then he paid $400 into that account. Like joke. I was not the one looking for the extra money on it, and that's it. My thought, the MRCP and the rest, he already told me once you're ready, So I do not think the cost of the exam should worry you at all. Just be sure that that is where you are going to, and I'm 100% sure God will make provisions for you. Thank you.
Wow, wow, wow.
Thank you, Dr. Ologun. Thank you, sir.
What a night it has been. Thank you so much. My sincere appreciations to our resource person today, Dr. Olufemi, MD Ologun. You have done justice to the topic, and we've learned so much from it. Let me also thank everyone that has contributed to the lecture and with your experiences. Thank you so much. I'm sure that your experiences is going to be extremely helpful to our younger colleagues as they come up in this profession. Thank you. I also want to thank everyone that has made out time to be in this lecture. Thank you for pausing whatever you are doing to be part of this lecture. And I'm sure that so much wisdom has been shared from this. I think that we'll begin to draw the curtain on today's lecture. Please make it a date with us. We'll continue to publish our lecture series. This is the first of our lecture series. Every month from now on, we'll be having one Saturday that